The COVID-19 crisis in the Australian state of Victoria has taken another turn with an outbreak in aged care homes. 384 fresh cases and 6 more deaths have been reported. The Army and public nurses are being sent in as the number of cases linked to aged care homes nears 800. Almost all elective surgery has now been suspended to focus resources on the aged care outbreak. ABC's Richard Willingham tells us more.
As anxious families gathered outside a Melbourne nursing home for a second day in a row, some residents were being evacuated to hospital.
I don't trust them, so I've run back here because I want to see my mum. I want to make sure my mum's all right.
Overnight, the Army stepped in to help staff at Epping Gardens, where 82 people have contracted the virus. At nearby St Basil's, there are 80 cases. For Effie Furtadis, the anxiety about her father has been replaced by grief.
They took him to the hospital on Wednesday and he died Saturday.
Like many who've lost loved ones in aged care, she's also angry.
They treated my dad like crap.
Hearing people saying that their parents or the grandparents have been left in dirty nappies, not fed whatever, ants and all that.
Some of the stories we've seen are unacceptable, and I wouldn't want my mum in some of those places.
At the request of Canberra, the state has made a dramatic intervention. All non-urgent elective surgery in Metro Melbourne is being cancelled so that healthcare workers from public hospitals can be sent into private aged care homes. Reinforcements will fly in from interstate.
The urgency of the situation requires me to return to Canberra.
There are 56,000 aged care beds in Victoria. 10% of those are run by the state government and have mandated staff-patient ratios. But the current crisis is predominantly in private-run facilities, regulated by the Commonwealth. Of the 769 active cases in Victoria, just a handful are in public homes. Almost half of Victoria's COVID deaths have been in aged care.
There is a fear associated with caring for complex cases in a COVID-19 situation.
COVID-19 has killed tens of thousands in nursing homes around the globe, and it struck New South Wales in the virus's first wave. Yet some argue the private sector and the federal government were still unprepared for this wave.
We knew there was short staffing. We knew the staff were lacking the skills that they needed.
The idea that our carers, that our nurses are not providing that care, I think is a dangerous statement to make. They are wonderful human beings and I won't hear a word against them.
This is a nightmare scenario for residents, their families and staff, as well as the authorities scrambling to contain this virus. It will require governments to work together rather than pointing the finger. And the latest flashpoint of this pandemic will only shine a brighter light on a sector that's already the subject of a royal commission. Richard Willingham, ABC News, Melbourne.